Remote patient monitoring is an important tool in supporting patients beyond the four walls of the clinic.
They know it's an app, they know it's automated, but it still feels personal.
Welcome back to Cancer Buzz, the show that brings you fresh perspectives and the latest in cancer care innovation. I'm your host, Summer Johnson. Each year, ACCC honors cancer centers that have creatively solved care challenges in their facilities with the Innovator Awards. And the winners present their programs at ACCC's National Oncology Conference in the fall, where other cancer centers have a chance to learn about and replicate the good work of their peers.
The only way that we're all going to move forward and continue making a significant impact positively in oncology is together.
Today we hear from Lauren Hughes, a registered nurse and director of Infusion services at Highlands Oncology Group, one of the 2025 ACCC Innovator Award winners. They've built a sustainable model for remote patient monitoring. Lauren, thank you so much for talking to us today. Let's get right into it. What were the challenges that Highlands Oncology was hoping to address?
We've gotten pretty big, and these patients can get pretty sick pretty quickly. And so it was a better way for us to be able to scale the quality of care that we're offering.
What's the feedback been like from patients?
For the most part, regardless of the age of our patient or their level of technology use or knowledge, we get positive feedback. They like the idea and the ease and simplicity of being able to pick up a phone and go to an app and just send a quick message and say, hey, I have a question about what I spoke to my doctor about in a visit today. Can someone call me back? Or, we've also heard, I really like it whenever the system sends me the automated check-ins. Specifically, we really focus on making sure those are being sent out when they first start a new regimen. And we've heard many times, time and time again, that they feel like, they know it's an app, they know it's automated, but it still feels personal. They feel like they're being checked on and cared for when they're on site with us. They also feel like we're continuing to check on them after hours. And technically we are, but again, that's where the work smarter, not harder comes in. And it is our technology that is helping us out there and saying, hey, patient, how you feeling? Tell us your symptoms. And I think it's just a nice, from their mouths, it's comforting that they're submitting these symptoms that in their mind, they're like, I think I'm okay. I feel okay. But we've heard that it's ease of mind because they know that if something does look off to us, if it is one of those soft signs and symptoms that isn't a complete red flag, it's more of a yellow flag that only a healthcare professional would identify as an issue, they know we're going to identify it.
The Innovator Awards are presented at ACCC's 2025 National Oncology Conference this October in Denver. Why is it important for cancer care professionals to attend in-person learning opportunities?
I've been in a lot of areas of nursing, and coming into oncology, I've been a nurse long enough and been in a lot of leadership roles that I came in a little bit arrogant, thinking to myself, I've learned a lot of areas and I'm a quick learner. I'm going to come in, I'm going to learn oncology. I'm going to get my OCN certification within 6 to 12 months. I got this. Well, for all the oncology nurses out there, they are laughing at me right now. This is the most complex area of nursing I think I've ever experienced outside of cardiology. Cardiology also kind of blew my mind back in the day. And, one thing I've noticed very quickly with oncology is there is so much research and funding going into research for cancer treatments. And there are tests and new technologies coming out basically daily to the point where as nurses and providers, we can't keep up hardly with all of these new offerings. And so it's extremely important that not only are we always trying to stay up to date with all of our free time, reading the journals of medicine and what have you of things coming out, but also attending these live conferences, because then you're hearing live time what is going on out in the world that you may not know anything about. And the only way that we're all going to move forward and continue making a significant impact positively in oncology is together. 2 heads are better than one. A world of heads are better than just one practice, if you will. So the more that we can all hear these things and then continue spreading the word to each other and keeping each other updated, the more that the advances that people are making daily will truly make a significant impact.
Thank you so much, Lauren. If you want to hear more about Highlands Oncology's model for remote patient monitoring and 5 other Innovator Award-winning programs, head to the show notes for a link to attend the 2025 National Oncology Conference. That's in October. You won't want to miss out. Thank you for listening. Stay tuned for more profiles of award-winning programs. For the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.